Hereford's Auctions Plus, an online initiative for selling Hereford cattle Australia-wide, will have its first sale on Friday, February 17 at 12 noon. An Australia-wide network of independent rural marketing agents has teamed with Herefords Australia to provide the opportunity for vendors and buyers to trade high-quality Hereford and Hereford cross cattle. The first sale could attract a catalogue of over 1,000 steers and heifers, with 680 already listed from Burke and Glen Innes in New South Wales and from Beachport, South Australia, according to Herefords Australia CEO John McHugh. It was expected that many of the cattle offered for sale would be EU accredited. Hereford prices, especially for EU accredited cattle, were equal to, and in many instances, more than any other breed. This was because of Hereford's additional weight for age, carcass quality, feed conversion, temperament and ability to weather unfavourable conditions. Rural Australians were burdened by significant healthcare delivery injustices that were not being addressed by current government policies. This was the view last week put to a Senate inquiry in an important submission from the Rural Doctors Association of Australia, the RDAA. Rural Doctors President, Dr Paul Mara, said Australians in rural and remote areas should have the same right to quality health services as their counterparts in metropolitan centres, but this was not the reality. To ensure rural and remote Australians had accessible and quality health services, the regions needed a stable, sustainable and appropriately skilled rural health workforce, he said. Rural medical practice was different to urban medical practice. Rural doctors worked in a range of communities and settings across a broad scope of professional activities. Bush doctors practice cradle-to-grave medicine, delivering babies, resuscitating severely injured patients, administering anaesthetics, providing palliative care and treating chronic disease and mental illness, as well as providing primary care in their communities. The smaller the rural community, the longer hours the local GP was likely to work when the demands of private practice, hospital work and on-call duties were taken into account. To the United States now. Indications are that the farm sector is bracing itself for an end to the almost century-old long free lunch of federal government subsidies. The Illinois Farm Bureau report that their analysts see the billion-dollar writing on the wall. Direct payment federal farm subsidies will soon be dead, and US farmers are readying themselves to adjust to a life without handouts. The proposed end of these payments by a fiscally strapped national government would reduce the federal deficit by $15 billion across 10 years. This news is being welcomed by Australians who have long rallied against inefficient farm subsidies in the USA and the European Union because the domestic subsidies distort world trade. Direct payments to farmers of corn, soybeans, wheat, rice and cotton were very likely to be reduced from $5 billion a year to nothing when the 2012 Farm Bill is drawn up.